Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Types of breast cancer and treatment. Responsiveness. Breast cancer has many different types. Proper treatment will be determined, in part, by the kind of cancer you have. /r/n/r/n breast cancer can be classified as invasive or non-invasive. Types of breast cancer include invasive ductal carcinoma, IDC, invasive lobular carcinoma, ILC, inflammatory breast cancer, IBC, and Paget disease of the breast. /r/n/r/n subtypes of breast cancer are also based on whether the cancer cells have hormone receptors or human epidermal growth factor 2, HER2, receptors. /r/n/r/nPhoto composite by Joules Garcia for Verywell Health. Getty images. /r/n/r/n breasts are composed of several different types of tissue. Most breast cancers originate in glandular tissue, which includes the breast lobes, lobules, and ducts. /r/n/r/n breast cancer starts when the DNA, genetic material, within breast cells becomes damaged or changed, causing uncontrollable cell growth. The type of cancer you have will be determined in part by the specific cells where these changes take place. /r/n/r/n breast cancer can be categorized as invasive or non-invasive, in situ. Meaning in the original place. /r/n/r/n breast cancer can affect people of any sex, but it is higher in females. Breast cancer affects 1 in 8 women in the United States. It affects 1 in 726 men. Approximately 1% of all cases occur in males aged 60 to 70. /r/n/r/nVerywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To reflect our sources accurately, this article uses terms like female, male, woman, and man as the sources use them. Discuss your risk of breast cancer with a healthcare provider to ensure you get appropriate screenings. /r/n/r/n invasive ductal carcinoma is also referred to as invasive breast cancer or as infiltrating carcinoma. IDC originates in the milk ducts of the breast. This type of cancer accounts for up to 80%, 8 in 10, of all invasive breast cancers. IDC is the most common type of breast cancer diagnosed in males. /r/n/r/n ductal carcinoma starts out as a non-invasive, stage 0 precancer, ductal carcinoma in situ. Thanks to early detection, 1 in 5 new breast cancers are discovered at this early stage. /r/n/r/n IDC originates in cells that line the milk ducts of the breast. As they grow and spread, the cancerous cells break through the duct's wall, infiltrating nearby breast tissues. IDC can metastasize, spread, outside of the breast through the bloodstream or lymphatic system. /r/n/r/n IDC has less common subtypes. Each accounts for under 5% of all breast cancers and include /r/n/r/n triple-negative breast cancer is an aggressive form of invasive breast cancer. About 10% to 15% of all invasive breast cancers are of this type. /r/n/r/n TNBC cancer cells do not have receptors for estrogen, ER, or progesterone, PR. These cells don't manufacture significant amounts of human epidermal growth factor receptor 2, a type of protein. Because these cells are negative for all 3 of these markers, cancers that originate in them are referred to as triple-negative. /r/n/r/n triple-negative breast cancer is more challenging to treat due to its faster growth and fewer treatment options. /r/n/r/n invasive lobular carcinoma accounts for around 10%, 1 in 10, of all invasive breast cancers. /r/n/r/n ILC originates in the cells found in breast lobules. Lobules are breast glands that manufacture milk during pregnancy and lactation. It is estimated that around 1 in 5 females diagnosed with ILC have cancer in both breasts. /r/n/r/n Like ductile carcinoma, lobular carcinoma may be diagnosed as a precancer in stage 0. Lobular carcinoma in situ, LCIS, does not spread outside of the lobules, but it does increase your risk of getting breast cancer in either breast. /r/n/r/n Inflammatory breast cancer is a rare and aggressive form of breast cancer. IBC accounts for 1% to 5% of all breast cancers. /r/n/r/n IBC is technically a form of invasive ductile carcinoma. However, its symptoms and outlook are different. It also requires different types of treatment. /r/n/r/n IBC is caused by cancer cells that block lymph vessels. The blockage stops the drainage of lymph fluid from out of the breast. The result is inflammation in the breast and symptoms that mimic an infection, like swelling, a rash, and pitted skin. The discoloration of the rash may be red, purple, or dark. /r/n/r/n Paget's disease of the breast can affect people of any sex but is more common in females. It's associated with 1% to 4% of all breast cancer cases. /r/n/r/n This condition affects the skin of the nipple and the areola, skin surrounding the nipple. People with Paget's typically have breast tumors caused by invasive ductile carcinoma or ductile carcinoma in situ. /r/n/r/n It is unclear whether this condition is generated independently or if the cancerous cells in ductile carcinoma tumors travel through the milk ducts to the nipple and areola. /r/n/r/n Phyllodes tumors account for less than 1% of all breast cancer cases. The cells in phyllodes tumors grow in a leaf-like pattern. This type of breast cancer originates in the breast's connective tissue, stroma. /r/n/r/n Angiosarcoma of the breast is a very rare and aggressive form of breast cancer that accounts for 0.1% to 0.2% of all cases. It originates in lymph vessels or in the cells that line blood vessels. Angiosarcoma of the breast can start in the breast and the skin of the arm. /r/n/r/n The two types are /r/n/r/n Breast cancer types may also be grouped into hormone receptor (HR) status. This helps your cancer team better determine the types of treatments needed. /r/n/r/n Breast cancers that are hormone receptor positive, HR positive, sometimes appearing as HR+, are tumor cells that contain receptors for estrogen or progesterone. Both of these hormones may escalate hormone HR-positive tumor growth. /r/n/r/n While HER2 refers to human epidermal growth factor receptor 2, HER2-positive breast cancer tumor cells manufacture the HER2/neu protein. The presence of this protein is associated with some forms of aggressive breast cancer. /r/n/r/n If you are diagnosed with breast cancer, an immunohistochemistry test will be done to determine if the cancer cells contain estrogen and progesterone receptors. /r/n/r/n These are the HR breast cancer subtypes, ranked from most common to least common. /r/n/r/n The type of cancer and its stage will determine the kinds of treatments recommended. The goal of treatment may be cure or remission. /r/n/r/n Some treatments are used for multiple types of breast cancer, including invasive ductile carcinoma, triple-negative breast cancer, and invasive lobular carcinoma. Several treatments may be used together. They include /r/n/r/n Breast cancer stages range from 0 to 4. The stage of cancer at diagnosis greatly influences treatment. /r/n/r/n The assignment of stage for breast cancer is complex and includes these factors. /r/n/r/n The American Cancer Society recommends you discuss the cancer stage assigned with your healthcare provider. Different combinations of factors can result in the same stage, and this can mean different treatments are recommended. /r/n/r/n mammograms, a procedure that X-rays the breast, are the best line of defense for diagnosing breast cancer early. It can be harder to interpret a mammogram of dense breasts, in which there is more fibrous tissue and less fat. Additional screening tests, such as an ultrasound, may be recommended by your healthcare provider. /r/n/r/n Some forms of breast cancer, such as inflammatory breast cancer, IBC, may be harder to diagnose than more common types. IBC is sometimes misdiagnosed because its symptoms mimic mastitis or other types of breast infections. A missed diagnosis can give the cancer time to spread. /r/n/r/n The most common type of breast cancer in people of any sex is invasive ductile carcinoma. Other types include invasive lobular carcinoma, inflammatory breast cancer, and Paget's disease of the breast. Breast cancer is also categorized by its hormone receptor and HER2 status. /r/n/r/n If you or a loved one is newly diagnosed, this may be confusing and feel overwhelming. However, breaking down breast cancer types by category helps to ensure that the treatments recommended to you are the most effective ones possible. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.